Hi, this is Dr. Eric Westman with another edition of Ask Adapt. And today is about total carbs versus net carbs. Well, there's a lot of confusion about this. There's no right or wrong. The best way I can explain it is that the total carb counting is like the prescription strength, and the net carb counting is like the over-the-counter strength. Not quite as strong as total carb counting. It'll work for many people. But if you have a serious metabolic problem, something like diabetes, you've had weight issues all your life, then you want to use the prescription strength low carb diet, which would be using total carbs and not net carbs. Getting to the questions, Cricket asks, I'm using total carbs until I reach my goal. Once maintenance, I'll do net carbs. Is this okay? Well, it depends, again, on your metabolic situation and then how you count net carbs. Another question was by Bryce, or a comment, is that Dr. Michael Eades claimed to have been the one to come up with the concept of net carbs, saying that it ended up doing the low-carb community a disservice since folks misused it for the purpose of eating low-carb junk food. I've been telling my folks to count total carbs, except for leafy greens, as their middle ground. I notice how I feel different when I have a more liberal interpretation of carbs in my life. Well, Bryce, I agree. Dr. Eades came up with the idea, and it wasn't something that Dr. Eades or Dr. Atkins or Dr. Rosedale or Dr. Bernstein used in their clinical practices. It was something that was developed rather recently. One of the purposes, I think, was to get more vegetables in the allowed food for the day. If you use net carbs, there would be more vegetables. So it fulfilled the nutritional guidelines better to do say an Atkins induction at a 20 net carb level. But then it also did introduce the corporate approach of putting junk food type food, bars and candies and things out there, because the net carb calculation allowed for the addition of fiber and sugar alcohols. So getting just again to what net carbs in theory mean, net carbs has the understanding that you don't absorb fiber carbs, and that you shouldn't count the sugar alcohol carbs as part of the calculation. Well, I've learned the hard way that some people actually do absorb fiber grams. Even if it's called non-absorbable fiber, it can be absorbed and impact the blood glucose. And also some sugar alcohols and other additives that are carbohydrates can affect ketosis and adversely affect ketosis. So when you're thinking of a net carb or how you count them, yes, most people would allow the fiber and the sugar alcohols to be deducted from the total to get the net. But then there's also a company who created their own method of calculating net carbs so that it doesn't add up on the label even. So to the conservative way, or the way that I want to make sure that it will work the first time, every time, regardless of how serious your metabolic problems are, that's why I use total carbs, because it doesn't assume that you won't absorb the fiber, and it doesn't assume that the sugar alcohols and other additives don't affect ketosis. Yong Chin asks, why did they come up with two measurements? I think it was to allow for better adherence or congruence with nutritional guidelines, and for the ability to have more store processed foods. You have more ability to make processed foods if you're using the net carb calculation. Remember, it's not that it's wrong, it's just that it's not as powerful as using total carbs. Susan says, I'm using total carbs and it's pretty easy. I also use your list of foods, and my question is, I eat my greens every morning in an egg scramble. Does it matter how you eat the greens, if they're cooked or raw? And I don't think that's a major issue. I think that's a small issue. It's okay to eat the greens with other foods. It's okay to have them cooked or raw. Another question was, I heard that John Marie asked, I heard that cooked spinach is much higher in carbs than raw spinach. Well, I think we're dealing with very small differences there. It doesn't matter to me if the vegetables or leafy greens are cooked or they're raw. Even when you're counting how much to have, the difference in total carbs is pretty minimal. Tammy asks, is there a maintenance part to the ADAPT program? I guess inferring that do you increase carbs, do you go to net carbs? And again, that depends on your metabolism. What we've learned now over the last 5 years is that it's actually fine to not eat carbohydrates. It's fine to be a fat burner. There's no obvious detrimental issue to that. So maintenance on the ADAPT program could be the equivalent to 20 total carbs per day or less that you start out at. Or you might be able to add back carbs. I prefer that you add back carbs slowly and using total carbs so that you don't have those possible errors introduced by using net carbs. Mandy asks, is there a deficiency for not having any carbs? In other words, do I need to supplement with anything else? Well, it turns out carbohydrates are not an essential nutrient, meaning our body can make the carbohydrate that it needs internally, and any vitamin or mineral that comes with the carbohydrates can be obtained in other foods. So there's really no need to supplement. I mean, we do recommend as a general principle that people should take a vitamin just because they're so cheap, and so we would recommend a multivitamin without iron, so an iron-free multivitamin, unless you've been taught to take iron by your doctor. Barry says, if I follow an all-meat diet and the carb count is 0, will this be a problem? Well, there is a subgroup of low-carb eaters who do a carnivorous diet, and I suppose if you ate nose to tail, eating organ meats, and ate like a carnivore did, then it probably wouldn't be any problem at all. Not a whole lot of science behind that, and I would wait before making a policy decision or saying that it would be fine until there were more published data to support it. And then Jane asked the same kind of question. I really don't want to eat vegetables anymore. Is there a metabolic need for greens? And, again, in theory, no. In practice, I don't know. And my point of view is that we don't know everything about nutrition. This is one reason why I prefer that you eat real food and not fake foods, not rely on the idea that we know everything about nutrition. So having real foods, including greens and vegetables, kind of hedges our bet against things that are in there that we haven't really learned about yet. New vitamins are being discovered, as the years pass. I hope that's helpful. That's the difference between total carbs and net carbs. Please subscribe, put your comments and questions down below.